Welcome, my name is Peter Strong. I provide online therapy via Skype. So Skype Therapy is a very good choice if you want to get help for overcoming anxiety and depression, or if you want help for the recovery from addiction, or of course if you are looking for online therapy for agoraphobia or other anxiety disorder. Online therapy is an excellent choice if you don't have access to a therapist locally, or if you're living abroad, or if you just find it difficult to leave home for any reason, such as if you're suffering from agoraphobia, or if you're taking care of children, or any other reason that keeps you homebound. People like the convenience of online therapy, and also it's much more comfortable for most people than seeing a therapist in person. It's a much more relaxed format, and I believe that's very important because it makes it much easier for you to get in touch with your emotions and to do the work that's necessary to help heal anxiety and depression. You need to feel comfortable. Another reason why people like online therapy is because it offers a greater sense of privacy, greater anonymity. And that's an important factor, especially if you're struggling with depression or addiction or difficult emotions that often are difficult to talk about. So having that interface of your laptop makes it a little more comfortable and less intimidating, makes you feel more relaxed. The style of therapy that I offer via Skype is called mindfulness therapy, and that's a very good way of working with anxiety and depression in particular. It really focuses on changing the underlying structure of reactive, habitual thinking that feeds anxiety and depression. So it's very important to overcome reactivity, because reactivity is the primary problem that prevents healing, that prevents recovery from anxiety or depression or emotional trauma. It's the reactivity that keeps the cycle of suffering going indefinitely. So mindfulness therapy focuses on these habitual reactive patterns that feed your suffering, and it helps you change those habits, because anxiety and depression are basically the product of conditioned habits. It's better to look at it that way than to think of them as some sort of medical disorder. That's very rare, that anxiety or depression is due to purely physical causes. You will know the difference if it is, and then of course you should go and consult with your doctor. But most people are simply stuck in these patterns of habitual reactivity that stop the anxiety or depression healing. So that's the focus of mindfulness therapy. It's about overcoming these patterns. And I will teach you how to do this during our sessions together. I will teach you how to apply mindfulness to overcome those patterns of habitual reactive thinking. Most people see benefits very quickly when you start applying these mindfulness techniques. that I'll be teaching you during the sessions together. So please contact me if you want to learn more about mindfulness therapy via Skype. So Skype is very important for online therapy because it allows you to see each other. And this is essential for good psychotherapy. It's not necessary to be in the same room, to be physically present with a therapist, but it is necessary that you see each other. That will allow the right quality and depth of communication that are really necessary for working with anxiety and depression. So if you'd like to learn more about Skype therapy using mindfulness, then please simply contact me and tell me more about yourself, what you have tried so far, and also tell me what days and times work for you, so that we can then go ahead and schedule your first Skype therapy session. Mindfulness therapy, when delivered over Skype, is very effective, and I really expect all of my clients to see substantial improvements within the first 3 to 4 sessions. It shouldn't take that long to really get on top of anxiety and depression. It's really about changing the quality of relationship that you have with your emotions. You have to break free from that blind habitual reactivity so that you can establish a fully conscious and present relationship with your emotions that's based on compassion and forces that heal rather than reactivity, which simply inhibits healing and recovery. So if you'd like to learn more and you're seriously interested in getting to the root of your anxiety or depression and making really long-lasting changes, then please contact me. Thank you.